I'm Glen Madrid. I'm a family physician here in Grand Junction, and I'm at Western Colorado Physicians Group, which is part of Primary Care Partners. Sometimes for the good, sometimes for the bad. I think certainly there have been a lot of great innovations and great new treatments for a lot of different disorders, but the cost of healthcare has really become something that's created more and more stress on obviously the patients, but really also the providers as well. Allowing patients to have access to all the different things that are out there has become more difficult. I think insurance companies naturally want to regulate and to some degree restrict some things, and so it takes more effort on the part of the provider, on the part of the physician, to be an advocate for the patient to try to get some of these things accomplished and done and get these services for our patients. We're working on in our office, we have what are called care coordinators. So essentially social workers that are on staff. So not unlike the behavioral health, mental health workers that we have on staff, having these care coordinators, social workers help us with what you probably have heard, the social determinants of health. So yes, there's disparities out there, and there always have been and probably always will be, but I think one of the things that we've paid much more attention to in the last 5 to 10 years is those determinants that are affecting the quality of care that the patient can receive or what we can give. And so things like transportation, housing. I mean, I suppose years ago there was a fair amount of homeless people, but I'm not sure that I knew, was aware, or made aware. But I certainly have seen that. I've got patients who do live in their car or live in shelters. Again, transportation. I think again over the years the transit system in the valley has improved, but I think it still could be better yet. But I think I know I have patients who use the bus system and they're able to come to the office. I know the taxi service also has, with the Medicaid population, they have vouchers, so sometimes being able to access that for patients. We have cooperation with home health agencies that help us go into the home, no matter where that person lives, and can check on people. And again, that's accessible to all aspects of socioeconomic states, as long as there's a need. But definitely, I think we have been enlightened as to the importance of the social determinants of health and how they impact our ability to give care. I think that's been an exciting thing to follow up on that. It's been exciting to have somebody in the office, our care coordinator, when we have issues, when there's food insecurities. Can they get their medications? What are they going to do after discharge from the hospital? They don't have a home to go to. And so having somebody on staff to help us, because I think years ago we left it up to social workers outside of our office and didn't have any control over that. Not that we necessarily have control, but at least we feel like we've got a more direct impact with our patients, so it's been very helpful. One of the things that has been great about the Grand Valley Mesa County is that we have had a lot of cooperation over the years, and give credit to the hospitals, to Rocky Mountain Health Plans, to the physicians, working cooperatively, allowing essentially the Medicaid population access to all the same care that everybody else has, whether they have private insurance or otherwise. And I think that has allowed full access regardless of what end of the valley you live in or what socioeconomic class that you're in. So my practice in particular is probably like most. I have full spectrum, and as a family physician, I see and have for years delivered babies and then taken care of people till grandparenthood. And so I've had that full spectrum, but again have had spectrum of Medicaid patients and private pay patients and insured patients. And so I think I have and my partners have a good cross-section of people throughout the valley. I do not myself, but one of my former partners has really taken that role on here in the valley, and she is actively treating and helping a lot of those patients. And I think that's been a great service because we haven't had that, at least that I'm aware of, until the last probably 5, maybe 10 years. Mm-hmm. It was never talked about. It was never talked about, and I think even at my national meetings and the state meetings, there's definitely been more attention to that. So I think it's not anything that I had any training for, in my training, and certainly an important topic though that's relevant to a lot of people. Well, there's definitely room for growth, and I think in this country, unfortunately, a lot of the care for the last several decades has been focused on specialty or subspecialty care. And that's great. We need our specialists and subspecialists. But the generalists, so the family physicians, so family medicine, internal medicine, pediatrics, there has been less recruitment in those specialties, and those specialties are what is necessary to help keep healthcare costs down. We're able to focus on preventative care rather than waiting for the patient to have a cardiac event, a stroke, complications from diabetes, obviously treating that patient preventatively, and so there's room for that to improve. Well, for most of my career there has been a divide between physical medicine and mental health, and what's happening now, and it's been a great thing, our practice has been instrumental in making a change to integrate mental health into our practice. In years past, if a person needed increased mental health care, virtually was always making a referral and hoping that that person would follow up, or encouraging that would happen. And now with integrated mental health in our offices, oftentimes we can do what we call a warm handoff, literally seeing that patient, they have an urgent need, and have our provider on staff help us immediately that day or soon thereafter, allowing us to really provide those services more timely and hopefully more effectively. Well, I think the pharmaceutical industry obviously is both part of the solution and part of the problem. So again, wonderful treatments that are out there, but the cost makes it prohibitive for a lot of people, or it's a struggle to get things approved. At the same time, we've seen, particularly with the opioids, A decade ago, there was a big push to use more opioids, and really in our training and in our continued medical training, physicians were encouraged to use more opioids. And now what it's gotten us into is a situation where there's really, as it's been termed, a crisis. And unfortunately, it appears that the pharmaceutical industry was sort of behind a big push, and that has created issues there. And so obviously we've had to draw things back and look at other options. And so I think there's good coming out of that in terms of looking at other ways to treat people for pain. But again, access to other medications, they are expensive, but I think with diligence, most of the time, most physicians can have access and allow their patients to have access to virtually all the medicines that they need, because there's always a good amount of the medicines that are available as generic. When we're looking at primary care and preventative care specifically, what does that really entail? That's really looking at preventing illness before it occurs. And so obviously staying as healthy as you can be is going to give you a long, hopefully healthy life. And a big part of that is being active and exercise. And I think one of the beautiful things about living in our area, and many areas of course, but is being able to go outside and do outdoor activities and staying active. So outdoor activities, exercise, hiking, fishing, golfing, whatever activities you want to be. And I think the beauty of doing that, a lot of times it also includes family time. And that's important for mental health as well. And I think an important thing for physicians and providers to encourage. So I think there are definitely inequities in our community. Something simple like having access to a park. You know, I often think of that. That gets back to that social determinants of health that we talked about. When you're encouraging that child, that young adult, elderly person, it doesn't matter. Get out, enjoy the outdoors, go play outside, get away from your computer, get away from the screen, the television. However, depending on where you are in the valley, where is a park? Where is a safe place? Is it walking distance or bicycle distance, or do you need a ride? Are you going to get on the bus? One of the things that we've talked about in years past too is something simple like lighting. Depending on the season, is it safe for that person to be outside at the park, on the basketball court? Things like that. So I think, you know, we talk about food deserts, and you know, you can look at parts of the valley where all you see is just fast food, and what else is there? There's nothing else. There's not a park for miles. And so I think that, you know, there's some aspects of our valley that you could look at and say there's definitely disparities and inequities depending on where you live. I look back at my childhood. I lived a half a block from a park. Had no idea how important it was. It was just natural. My mom and dad knew where I was because the whole neighborhood was there all the time. Didn't realize how lucky we were. But boy, I spent years at that park. But if you don't have that, you know, there's so much you're missing out on. Just because we know that there are disparities and inequities doesn't mean that we have the answers, but I think if we can continue to work on them, and as a community, in my office we've created a community access map. So essentially a tree, if you will. So when we have issues, we can kind of look at our map and say, well, what are the services? What are the organizations? How do we access and give our patient direction on how they can hopefully get a solution to whatever their issue is, whether it's, again, the food insecurity or safety or whatever else. Yeah, we don't have the answers on a lot of things, but I'm continuing to work on them. And we live in a great community, and there's always historically been a lot of cooperation among organizations, and I think that's something that we can be proud of. But there's always work to be done.